after having the surgery and now still dealing with reconstruction just made me wish what I had. You don't realize what you have until it's gone, it's taken.
The diagnosis was the first shock. Treatment was the second.
Surgery is often the only option for breast cancer patients to finally be cancer-free. Caitlin Thompson introduces us to her surgeon, who's helped many women in the metro.
Women are resilient. You know, they're ready for surgery.
And as their surgeon, Dr. Scott Hamling is ready to cure women of their breast cancer. But each patient's treatment plan is different, and how doctors figure out who needs what and when has changed throughout the years.
What determines having a short treatment plan and a longer one?
Tumor biology. So in the past, most treatments were based largely on patient stage, so size of the tumor or lymph node involvement. And we always used to say, good news, it's a small tumor, bad news, it's a big tumor. But nowadays we know it's the tumor biology. How aggressive do cells grow?
Because of my tumor's biology, I did need chemotherapy before I had surgery. Dr. Hamling told me that the first time I met him, just days after my diagnosis. But then I didn't see him again for months.
Patients look different when they come in, you know, because I'm seeing them towards the end of the last few cycles of chemotherapy when they feel the worst that they've probably felt the whole time. Their counts are bad, they feel bad. You know, most have lost most of their hair, fingernails are not good, and you know, they're sick of being sick.
And even though some patients can't even feel their lump after chemo, Dr. Hamling says surgery is still necessary.
We always need surgery to make sure that the cancer's gone.
My surgery involved a bilateral mastectomy with reconstruction, a procedure that's difficult to process before and after it's complete.
Physically, you know, mastectomy changes the body a lot, but emotionally it changes the body a lot. And even if patients don't feel that early on because they're focused on oncological care, you know, we have to look at ourselves in the mirror every day. And so our perception, how we feel about ourselves, can change with good or poor outcomes.
And poor outcomes do happen for patients, whether it be complications from surgery or pathology reports that show cancer is still there.
Giving bad news, there's no perfect way to do it. And you cannot give bad news the same way with different patients.
Different patients need different approaches, especially when those patients are young.
The patients younger than 40 typically have more aggressive tumors. They present with more advanced disease. They're in a certain part of their life where they're forming their life, you know, relationships, schooling, kids, new jobs, things like that. And you kind of feel like you're crushing their dreams.
That's why Dr. Hamling does what he can to save lives and give people more time, both with surgery and compassion.
How do you go about that?
You have to be objective, but have hope.
Hope that people can be cured and Dr. Hamling's services will no longer be needed.
That's probably the most rewarding is, you know, that good news that you don't need me anymore. You know, there's nothing I can do. You're perfect. You know, just go live life. So it's a balance.
Sure.
But thank goodness there's more good, you know, good stories to tell than bad stories.
Thankfully, my story is a good one. My pathology report came back clear after surgery, but I will still meet with Dr. Hamling for future screenings until I graduate from his care.
That is good news indeed. Thanks a lot, Caitlin. Now, if you haven't seen Caitlin's other stories, you really need to check them out on our website, WHO13.com. Just look for the Surviving Breast Cancer link under the News tab.